Okay, we're going to review pediatric infectious diseases. First one we're going to talk about is measles, which is actually called rubeola. It's caused by the paramyxovirus, something like that. Transmitted by airborne or direct contact. Signs and symptoms: fever, malaise, the 3 C's, coryza, cough, and conjunctivitis. Coryza, that's basically a fancy word for swollen mucous membrane, so otherwise known as a runny nose, cough, and conjunctivitis. They just wanted it to be, I guess, a cute little way to remember. It was 3 C's. A rash starts out on your face and it spreads downward. Your interventions, now remember this is a virus, so all we can do is support the patient. Bed rest, a cool mist vaporizer, dim the lights, antipyretics, and vitamin A. The next one is rubella. Now you think about your MMR vaccination. What is that? Measles, mumps, and rubella. Even though rubella is basically German measles, but it's caused by a different virus. It's a rubella virus. I think the reason they call it German measles or the measles is because it does present just like, regular measles. It's airborne. Again, kind of the same things: fever, malaise. The rash, again, starts on the face and works downward. So that's just like, the other measles. It starts on the face. Same thing. Bed rest, vaporizer, antipyretics. This one's big. It is very pregnant women, if they get it, it can be passed on to the fetus. So you want to make sure that you isolate pregnant women from anyone that has German measles. Here's mumps. We just talked about the MMR. So here's one of the M's. Again, this one's droplet transmission. Fever, malaise, anorexia, jaw or ear pain. I need to fix that. Jaw or ear pain aggravated by chewing. That's the parotid gland swells. It swells up. That's where the mumps. You get the distinctive, very swollen face because it's that gland is swollen. So they have a lot of pain chewing. Interventions: bed rest. Avoid foods that require chewing. They may need just something that's very doesn't, applesauce or yogurt. You can apply hot or cold compresses to the neck. You want to apply warmth and local support with snug fitting underwear for orchitis. Now that's with males. That's what's so a big difference between when males and females get it. Females have, the swelling of the face. The males have that as well, but they also will have swelling of their testicles, and it's apparently very painful. A common problem with mumps is aseptic meningitis, and that's when they will see the virus in the cerebral spinal fluid. And some signs of that, of course, would be the neutral rigidity, lethargy, and vomiting. So definitely if somebody has mumps, you need to know if they start having a stiff neck to start watching out for that, because they could have meningitis. Mumps, it says, is even one of the leading causes of unilateral nerve deafness. But then it says, however, it's not common. So I'm not sure how it can be a leading cause and not common at the same time, but that's what your book says, so I'll believe it. All right, chickenpox, varicella. Again, another one that we have a vaccination for now, the varicella vaccine. This hasn't been around that long, probably as long as all of you have been alive, but certainly not. It was a new vaccine that I recall when it came out. Chickenpox, droplet transmission, signs and symptoms: fever, malaise, anorexia. The macular rash at first appears on the trunk and scalp. A lot of times you'll see it first on the belly, and then it moves to the face and extremities. The lesions become pustules. They dry, form a crust. You want to isolate until all the vesicles have dried. You can use an antiviral agent to help decrease the number of lesions and help decrease itching. But basically it's another one of those things where we just have to support them. People that have the varicella vaccination can still get chickenpox, but often it's not as severe. Um, this also is related to shingles. As you get older, you always will have this virus in your body, and as you get older, it can come out as shingles, which I think we've talked about before. All right, pertussis, which is whooping cough. That's the Bordetella pertussis. There's vaccination for this too. This one again is droplet. It's a horrible respiratory infection with a severe cough with a whooping sound. May experience cyanosis, respiratory distress. With interventions, hydrate, may need to provide suction or humidified oxygen. You want to reduce any thing that could make them cough, like dust, smoke, environmental factors. And I said it twice on here, so I must really mean it. I have a video pulled up here of what whooping cough sounds like in a child, because it's pretty distinctive. I'm going to play this. So you can see that sounding very much like a whooping. All right, diphtheria is the next one we're going to talk about. You don't really see a lot of these anymore because we do have vaccinations. It's starting to see a little bit more of it because of the anti-vax movement, but I just pray that that turns around and that we can eradicate these illnesses. Diphtheria, direct contact is how it's transmitted. This one is pretty nasty. They'll have a fever, a sore throat, foul smelling, mucopurulent nasal discharge. But here's the thing, they can get a pseudo membrane form in their throat. So basically a membrane will form across the back of their throat that will interfere with them eating, drinking, and breathing. They can get neck edema. So definitely someone like this would need to be hospitalized. You would need to make sure that a trach kit is nearby in case suddenly they are unable to breathe. We have scarlet fever. It's a streptococci, group A beta hemolytic streptococci. Direct contact or droplet. Abrupt high fever, flushed cheeks, vomiting, headache, enlarged lymph nodes. A fine red sandpaper-like rash can develop in the axilla, the groin, and neck, and then spreads to cover the entire body. And it will blanch with pressure. So this fine red sandpaper-like rash, it will blanch. Desquamation, a sheet-like sloughing of the skin on the palms and soles. So that's very classic for scarlet fever. A sheet-like sloughing of the skin, the palms and soles. Appears week 1 to week 3. The tongue is initially coated with a white, furry covering with red projecting papillae, and it's called a white strawberry tongue. By the 3rd to 5th day, the white coat sloughs off, and then it's a red swollen tongue, and then it's called a red strawberry tongue. Your tonsils are going to be reddened, edematous, and covered with exudate. All right, the next one is fifth disease, erythema infectiosum. You see this a lot in kids. I've got a lot of friends that their kids have had fifth disease. It's almost like you take your kids, start them off in daycare, and they're going to get fifth disease. The biggest sign, the first sign that you'll notice is the erythema of the face, and it's a slap cheek appearance. So that's one of the first things that catches people's attention, is it looks like the face has been slapped. They will get maculopapular spots. They're symmetrically distributed on their extremities. That's kind of a key point here too, I guess. Again, supportive care, antipyretics, analgesics, anti-inflammatory medications. Pregnant women also should not be in contact with an infected individual. Influenza. We're all pretty familiar with influenza. Affects the respiratory system and highly contagious. It's droplet precautions. Fever, sudden and high. Headache, body aches, fever. I already said fever. Chills, fatigue is what I meant to say. Cough, congestion, sore throat, loss of appetite, vomiting, diarrhea. Antiviral medications, like we know, like Tamiflu. Typically, you got to catch it pretty early. Give Tamiflu, and it's not going to cure it, doesn't make it go away. It just helps lessen the effects. Biggest thing is bed rest and plenty of fluids. We've added COVID-19 in our book now. Coronavirus. I think we all know this one backwards and forwards. We all learned this one together. Tends to be less severe in babies and children. Adults, tend to have the worst of it. It's droplet precaution, fever, cough, excessive fatigue or diarrhea. Interventions, rest and hydrate. Now, there's been some medications that they've tried, even like ivermectin, which is basically a dewormer that's used in horses. So, a lot of different things that people have tried, and, I don't know. I don't know if they've actually come up with an absolute tried and true. I just know don't drink bleach, don't inject bleach. There's actually been people that have done that, and they've died. All right, the last two slides are your immunizations chart. You guys will need to know this. I mean, you'll probably be hit up with this on your NCLEX. The first one is birth through 6 years, and the second one on here is 7 to 18, because it is a little bit different. When you have a baby, you get a bunch of immunizations, and then it's like when you turn 5, you get what we always called your kindergarten shots. But then, and then as you get older, I think they have the 7th grade shots now. So there's your charts, so you can look those over. All right, that was it. Any questions? Let me know.